A wheelchair bike can be a wonderful program for your nursing home. There are several companies that manufacture wheelchair bikes. Some are made in Europe and distributed in the US. They have many safety features, like a special kind of harness and headrests, and swing-away leg rests. All in all, the bike is a fantastic program for people who may have depression, sadness, or loneliness. If you have residents who just don't want to come out of their room or you can't get them to socialize with others, try the wheelchair bike. Even though you think it's going to be a one-to-one activity, it actually can be a social activity, as you'll find from the next slide. One approach is to find 3 to 5 residents with similar symptoms who would like to engage in this outdoor activity with you. You will need a recreation therapist and a helper because you're going to be transferring people on and off this bike. One person can carry on a conversation with the residents about biking in the past and reminisce about bikes that they may have had as children or who they taught to ride. The other person will, one by one, take the residents for a ride. When the resident comes back, he or she can tell the group what they saw and what they experienced on the ride. Often this group starts to bond and they become a biking club. Daily riding is a great way to encourage the group to bond, with weekly rides after the first couple of weeks. In addition, you can ride people to another activity when the program ends, so it acts as a transition into another group. Everyone needs physical activity and exercise. In a nursing home, residents have a wide variety of physical and cognitive abilities. It may be helpful to grade or level your exercise program so that all people can benefit. It could be as simple as just walking outdoors with a person. That could be an exercise program, or it could be a very laid out exercise routine where you all work the major joints and muscle groups. Grade it so that the resident could get increasing levels and variety of activity, and you can measure some of the outcomes. Sometimes it's helpful to have a lower functioning residents in a very small group, or individually, so you are able to give good individualized attention and assistance as needed. Higher functioning residents may be able to follow a leader of the group. Music can be used successfully to aid in rhythmic movements during exercise groups. Be sure to pay attention to everyone's ability to hear directions if you use music and adjust accordingly. Music almost always has the potential to be a beneficial intervention. However, there are many things to consider when you're playing music for a resident. Just like you don't like all the same music as your friends, our residents don't like all the same kind of music. Be sure to ask your residents about their favorite music, artists, genres, and so on. If you are unable to express their desires, talk with family members to see how you can put together a selection of music that is appropriate for each individual. Also consider what time of day music is best for an individual. Think about how it fits into the resident's day, their specific preferences, and their needs. Rhythm and tempo of music is also important to consider. Music can be a very active activity by adding instruments, singing, or dancing. It can also be done as a group activity or independently. There is a wonderful program called Music and Memory, which helps support providers in setting up individual playlists for each resident, and use iPods or other technologies to listen to their favorite songs most any time. Since this is an individual activity, it can be very personalized. When you set up social groups, it's important to individualize the groups. Be sure to understand and know your residents. Sometimes it's best to start with one-to-one interactions with a staff member to build rapport and a relationship. After a few times meeting together, perhaps you can add another resident who has similar experiences, interests, or personality. Then eventually it's possible for that pair of residents meeting to turn into a small group with a leader. And the group can become a little more structured, doing particular tasks or activities together, such as cooking, playing games, making crafts, or having a topical discussion. It's important to help people connect with one another, if that's something they want to do. Often people with dementia are interested in socializing, but it can be hard for them to build relationships with other residents without assistance from staff members. There are also residents who have no desire to participate in group programs, which is absolutely fine. Keep a person's long-term personality, habits, and desires in mind as you encourage them. When you are forming groups, be sure to consider the relationships already present between your residents. For example, you may know there are 2 residents who really do not get along with one another. This doesn't always mean they can't be in the same group together, but being aware of the situation and perhaps setting them apart from each other to give them a little space can lead to a more successful group. As you finish up a group, it's important to transport residents back to their rooms or common space in the nursing home if needed, and to leave them with something to do. You should never finish up, clean up, and walk away without leaving something for them to do, whether it be watching television, reading a newspaper or magazine, listening to music, and so on. Ask the resident if they would like to do any kind of those activities and help facilitate that as you leave. With the next group of slides, we will be talking about arts and crafts clubs. These can be great activities for some residents and staff members because their interests can intersect. For example, you may have a staff member who likes to paint. You could start a painting group where residents are able to paint different pictures or items together with a staff member who is skilled and interested in that area. It's always a good idea to have a staff member who is passionate about a particular thing lead a group about that interest area. For these groups, it can be very beneficial to meet on a weekly basis when possible. This helps build continuity and relationships within the group. It's also a great way to engage and welcome new residents who might be interested in the group. Whenever you do an arts and crafts activity or club, it's helpful to have a sample of the project ready ahead of time. That way the resident can decide if it's something they are interested in and they can see the end goal. Also, focus on the resident putting the project together as much as possible. They may need help with individual parts or need hand-over-hand assistance at times during the project, but it's important to have them do as much as they can themselves for the process to be therapeutic. At the same time, don't let them get too frustrated or the project won't be successful either, and the resident won't want to come back. Some ways to help ensure success are: give short, single-step directions, repeat as needed, don't give too many choices at a time. For example, ask, would you like red paint or blue paint? Be present and alert to residents with dementia using sharp scissors, knives, hot glue, and any other potentially dangerous items. You want to make sure you are there to monitor their use at all times. And encourage. We can also use relaxation as an activity. Timing is very important. There are times in a nursing home that can be more active with noise, people, and restlessness. Change of shift, late afternoon, sundowning, and bedtime can be particularly stressful for residents. These are perfect times to offer a relaxation type of program. Guided imagery can be very effective. It's ideal to have a separate room or space to do this program in, but it's not always possible. Try to make the space as quiet as possible, with no distractions. For guided imagery, you will want to read a script for about 10 minutes or so. At the end, hopefully residents will not be too sleepy, but will be relaxed and focus on the next program or activity in their schedule for the day. There are many simple scripts you can use for guided imagery that you can find in books or on the internet. You can also just make up your own simple story about nature or going for a walk and talking about things that you can see. Give a lot of detail to the residents so they can experience it as part of the story. This has been particularly useful in the later afternoon and early evening as residents transition from an active time into the evening meal. Many residents love animals and benefit from having a variety of animal-assisted activities offered. Please be aware that there are residents who are not animal lovers, are allergic, or even fearful of animals. Be sensitive to these needs, and as always, knowledge of your residents and their preferences is key. There are many ways to go about providing animal-assisted activities in the nursing facility. You can ask for volunteers with animals that are appropriately calm, don't jump, and have a good personality for visiting. Your local humane society or rescue organization can be a good resource. If available in your area, therapy dogs or other animals are particularly good and preferred partners for this kind of work. Pet Partners, formerly known as the Delta Society, is a good resource at petpartners.org. It is best to have a staff member participate in the pet visits with the volunteer, so they know about the individual residents. Staff can guide the volunteer and animal to appropriate residents and can help facilitate the visit. Sometimes this works well in a small group setting. Other times, it's a great benefit to residents who prefer to stay in their rooms. Then there are a variety of activities that can be done with this team. It can be as simple as petting or talking to the animal, holding it if appropriate, or even reminiscing about family animals. If appropriate, the resident could also help to brush the animal, which can be calming and a good sensory experience. Studies have shown that animal-assisted activities can help with things like pain, lowering blood pressure, and lowering anxiety levels. Aviaries, fish tanks, and farm animals such as baby chicks can also be great ways for residents to interact with animals outside of the conventional therapy dog or cat that would visit. It's good to get copies of vaccination records for animals that visit. If anyone has concerns about infection control, helpful information is located at www.cdc.org. The next set of slides talks about cooking as an activity. Cooking is something that is universally familiar. We all do it in one way or another, and all have our favorite foods, recipes, and meals. It is a simple activity that brings familiar, comforting routines of home back into the nursing facility. It provides residents with an opportunity to share tools, food, experiences, and memories, and can be a really fun activity for people with all levels of dementia. When offering a cooking activity, it's helpful to plan thoroughly before starting. If you have a kitchen, you're able to make more traditional recipes, but it's also possible to be creative and use something simple like a microwave or blender and have a wonderful cooking program. It's important to carefully plan hygiene. Make sure everyone washes their hands and dries them well. You can also use gloves. If someone has long hair, it's appropriate to ask them to tie it back or wear a hairnet. When planning a cooking activity, the residents can be a big part of the planning process. They can look through ads or recipe collections and can help plan a menu or specific project. As with all programs, know your residents' abilities as you gather them for a cooking program. Consider modifying recipes to be printed in large print on paper with short single-step directions. If you're making a cake, perhaps one person can measure while another reads the recipe. Another can stir the ingredients in the bowl, another can crack the eggs, and so on. Sometimes it's helpful to have a recipe already made so you don't have to be so concerned with the one that the residents make turning out so well. The process is more important than the end result. Be careful to find ways for everyone to participate and not to take over as a staff member in charge. High, middle, and low functioning groups can all have cookie groups based on function. High functioning groups could prepare a picnic meal or breakfast. Middle functioning groups could make a snack such as cheese and crackers. Low functioning groups could make butter or ice cream or use simple tools such as an apple peeler. Most residents benefit from sensor-motor experiences throughout their days. This doesn't need to be a standalone activity, but can be individualized experience before or after care or as a one-on-one activity. For example, if someone is sitting in a chair and seems to be drifting off to sleep, but could likely be engaged in a program if they were stimulated, it's a great opportunity to engage them with something soft to touch or hold, with a hand massage or with aromatherapy. If they respond positively, it can be a nice way to transition into going to another program they are interested in. You can also use sensory activities at the beginning of or during another activity. It could be something as simple as passing a flower around so each person in the program gets to smell and touch it. It could be a brown paper bag with a hidden item inside so that each person reaches inside and tries to think of what it is, then passes it on to the next resident. These sensory activities use the mind and body to awaken a person's senses. Try to include a variety of senses individually or in a combination with one another. Try to include touch, taste, smell, pressure, and some opportunity to move when you're doing a sensory activity. You want the person to be calm but active and ready for the next thing to happen in their life. In summary, there are many great activities. Included in these videos were just a few ideas, but you know your residents best. Be creative, and with the interests of your residents and the strengths and interests of your staff, the ideas are endless. Think about your specific strengths. Think about the residents' needs and be inventive when you design these meaningful activities for the people you're caring for. Up next, to help you put this information into practice, please preview and complete the workplace exercise that accompanies this part of the training program, and work through the case-based learning program. Then go on to Part 4. In Part 4, we will talk about how to work as a team to get meaningful activities in place and working for residents with dementia.